Welcome back to Yahoo Finance. I'm senior health reporter Anjali Kamlani. Big tech has made its presence known in the healthcare industry over the last decade, and Amazon remains bullish on this sector. The e-commerce giant's push into healthcare with its online pharmacy has provided millions of people with discounts and made prescription drugs more affordable for customers. So, to wrap up Yahoo Finance's Healthcare Week, I'm joined by Dr. Vind Gupta, Amazon Pharmacy Chief Medical Officer. Dr. Gupta, thank you so much for joining us today.
Good morning, Anjali. Thank you for having me.
I want to start off with everything that Amazon Pharmacy has done. It is the 3-year anniversary as well, I believe, of the launch of this program. And we've seen how over the years there has been a buildup of a number of different health care strategies for Amazon. But let's focus on the pharmacy for a second. You've got the $5 RX pass, you've got discounts, you've got automatic coupons, which, as we understand, has saved customers $9 million over the course of since the launch. So how does this all play into sort of what the future is for this segment?
Well, Anjali, I say this as a pulmonologist right outside an ICU here today. I have a foot in both worlds, traditional healthcare and what we're building at Amazon, specifically at Amazon Pharmacy. As you pointed out, all these feature sets are really set to address the biggest problem in healthcare, which is patient information, patient awareness of services, of products that can actually result in lower costs to them for their prescription medications. We have a prime prescription savings program that Anjali was shown by an external group of pharmacists from the University of Toledo to actually save more money than when patients use, say, their copay for 20 of the most common generic medications across the country. That price transparency gets talked about a lot. It's price transparency in medicine doesn't really exist at scale. We're trying to solve for that at pharmacy through the coupons program, which you just talked about. If there's a coupon to make branded medications like insulin products cheaper, we're going to figure out a way to automate that so patients don't have to think about it. That's exactly what's underpinning the coupons program that has saved over $9 million for patients across the country that utilize our services. It's basically just automating a manufactured coupon for a branded medication that we support through this program versus having somebody having to download a bunch of paperwork and go through a very complicated morass of hurdles to get those savings. 85% of the time, the American patient across the country doesn't actually realize those savings, Anjali. We're trying to make that easier.
But at the same time, with all this growth, we've also seen how there are some limitations to what you can do right now. What can you explain about sort of how this industry works and why maybe branded drugs or more expensive drugs aren't something that Amazon can address right now?
Well, I would say as part of the coupons program, every medication that's part of that, for example, is a branded medication for which there is a coupon. We're working directly with manufacturers to see, can we actually automate that as part of the checkout process for patients so they don't have to go find it. Right? But to your broader point, so what are the more systemic issues across healthcare that we feel across our businesses, not just pharmacy, we can address? We know medication non-adherence impacts 50% of American adults across the country. 1 in 2 don't have access to basic primary care when they're still acutely ill. There's a huge supply-demand mismatch in terms of healthcare workers that will be needed by the end of the decade versus the rising demand as we have an aging population. What are we doing? We're focusing on getting care through Amazon Clinic and One Medical, brick and mortar, One Medical in over 30 zip codes across the country, 30 major cities, Amazon Clinic, asynchronous and synchronous telemedicine in all 50 states. So getting care much easier now. We just launched a Prime benefit, $9 a month for Prime members, where you can actually get that One Medical membership, get that in-person care, or get virtual care through One Medical, and really address that issue about access that I talked about earlier. Get medications through Amazon Pharmacy. We're trying to make it easier. Getting as fast as possible, but also, again, focusing on price transparency and then getting well, just really focusing on staying healthy, making sure patients have the information they need to focus on prevention, not focus on sickness. So that's really been the core here. And we think we can really be part of the solution to address some of these systemic ills that you're seeing across the country.
I'm glad you brought up One Medical, because we do know that now this has sort of formed a nice little chain for Amazon's health strategy, getting patients the care through One Medical and then finding the medications through the pharmacy. A nice little tie-in. It has been many years building up to this, and Amazon has previously struggled in the space. What's changed, and why are we seeing, a little bit more sort of outspokenness from the company now?
I'm glad you brought that up. What's changed is we've seen impact. This is the third year anniversary of the founding of Amazon Pharmacy, 1 year anniversary of Amazon Clinic. One Medical has been growing just over the past decade. But they're putting me out there as a pulmonologist to talk about a lot of what we're doing here, because there's a lot of excitement on the clinical impact here, Anjali, that we feel like we're driving. When it comes to, again, cost savings for branded medications, we're approaching upwards of $10 million saved for patients. That means something for cost-related medication non-adherence. Cost drivers are a big reason why people don't stay on their medications. You mentioned One Medical. One Medical, through their impact program for chronic disease, Anjali, it's seeing 3 times improvement in A1C control for diabetics that enter that program versus usual standard of care, because they have a very engaging platform. We're seeing real traction here in terms of clinical impact. We've been at this now for a little bit. We recognize we're still early, but also that connectivity. Should somebody want a quick triage point, it's cold and flu season, they're waking up, maybe they feel unwell, they can go to One Medical, get a same-day appointment in under an hour. So they need to see somebody in a city we have a physical presence in. In under an hour, they can get that touch point, get triage, get a diagnosis. Within that same day, say if they're in Seattle, and get medications delivered right to their doorstep. So that triage to treat, that connectivity of our services, should somebody want that seamlessness, is now available to more people across the country.
And of course, exciting things like drone delivery on the horizon. So we'll definitely be hanging out to see more of that. Thank you for your time today, Dr. Vin Gupta, Amazon Chief Medical Officer.